I have really three main roles here at the University of Michigan. As an assistant professor in the Department of Medicine and Division of Pulmonary and Critical Care, I'm responsible for caring for patients who are admitted to the intensive care unit. In addition, I also spend the vast majority of my time as a health services researcher here at the Institute. And then finally, I serve in an administrative role as the director of the Epidemiology and Health Policy Program for the Michigan Center for Integrated Research in Critical Care. I've practiced in many ICUs around the country, most of which have been affiliated with major academic medical centers. So some of the best hospitals in the country, and despite that, many of the therapies that we knew were to be beneficial in the patients that I was caring for were not being delivered to them. So that really sparked my interest in trying to understand what are ways that we can identify the quality of care that's delivered to patients in the intensive care unit and try and remedy some of those deficiencies that I was observing. My work really addresses, I think, two primary challenges. First, the care that's delivered to patients in the ICU is exceedingly expensive. At the same time, we also know that care delivery in the ICU is inefficient. So while the vast majority of people who are admitted to the ICU require life-sustaining therapies, probably about 20 to 30% of those patients are admitted to the ICU who don't necessarily need to be there. And so I'm very interested in understanding how we can use the resources in the ICU for the patients that have the greatest ability to benefit and spare its use from those who perhaps can't benefit. In some of my recent work, I'm interested in understanding how national accountability measures may impact the care we deliver for our sepsis patients. Sepsis is the body's response to overwhelming infection and the most common cause for hospitalization in the United States. I've been in discussion with Skip Campbell, who's the director of the Michigan Surgical Quality Collaborative, who also lives here at the Institute, to try and decide whether or not we can identify how to improve care for sepsis within that specific collaborative in the state of Michigan. I think one of the most important issues facing healthcare today is trying to improve the quality that we deliver to our patients. Our system, when it functions well, has the capability of really doing miraculous things. We have the ability to diagnose patients earlier than we've ever been able to before. We have advanced technology and therapies that really has the ability to save lives, prolong life, and improve the quality of life for our patients. But all too often, our system fails to deliver those therapies or diagnostic tests to the right patient at the right time. Addressing these challenges requires first to understand and characterize what the problems and challenges are with delivery of healthcare, and then really designing system-level approaches to implementing the best possible care for our patients. IHPI, if I were to describe it to a layperson, I would describe it as a coalition of scientists who are interested in improving the care that we deliver to our patients, the affordability of that care, the efficiency of care, the equity in the care that we deliver, with the hope that on a national level we can change how healthcare is delivered. My primary motivation to become a member of IHPI was to participate in the really rich intellectual infrastructure that exists here. Many of the investigators that I actively engage with on a day-to-day basis I would not have engaged with had I not been involved in the IHPI. In 5 or 10 years, the future of healthcare will be somewhat different than it is currently. I think there's a lot of reason to be optimistic about the future of healthcare. In particular, the Affordable Care Act, having now rolled out, has really done miraculous things for providing care for patients, not only insurance, but also it incentivizes improving the quality and the value of care that we deliver to our patients, which is something that we've been trying to do for decades. IHPI can play an instrumental role at really evaluating the effectiveness of each of the aspects of the Affordable Care Act that are currently being rolled out. Not only evaluating the efficacy of those specific programs, but also potentially having the intellectual resources to be able to generate novel programs that can be tested in innovative ways to understand whether or not we can make differences in patients' lives through changing how we deliver healthcare.